Have you ever heard of PCOS, and do you know how it can affect pregnancy? PCOS, or polycystic ovarian syndrome, is a common condition that alters the workings of a woman's ovaries. This disorder, while largely prevalent, is often misunderstood or even unheard of by many. PCOS is marked by three primary characteristics. First, it's associated with irregular periods, meaning the ovaries do not regularly release eggs or ovulate. Second, women with PCOS tend to have high levels of male hormones or androgens in their bodies. This may manifest in physical signs such as excess facial or body hair. Finally, the condition is characterized by polycystic ovaries, where the ovaries become enlarged and contain many small follicles. So how does PCOS affect a woman's body? Well, it can lead to a variety of symptoms. These include irregular periods, or in some cases, no periods at all. Women with PCOS may find it difficult to conceive due to irregular ovulation or absence of ovulation. Other symptoms can range from excessive hair growth, usually on the face, chest, back, or buttocks, to weight gain, thinning hair, and even hair loss from the head. Women with PCOS might also experience oily skin or acne. The causes of PCOS are not entirely known, but it often runs in families. It's thought to be related to abnormal hormone levels in the body, including high levels of insulin. So how would you know if you have PCOS? The symptoms of polycystic ovary syndrome can vary from woman to woman, but there are some common signs that might suggest this condition. Let's walk through them together. One of the most common symptoms is having irregular periods, or even no periods at all. This is because the ovaries do not regularly release eggs, a process known as ovulation. This irregularity in the menstrual cycle is often one of the first signs of PCOS. Another common symptom is excessive hair growth, usually on the face, chest, back, or buttocks. This happens due to high levels of androgens, the so-called male hormones in the body. These hormones can also cause other physical signs, such as thinning hair or hair loss from the head. Weight gain is another symptom that many women with PCOS experience. This is often accompanied by difficulty losing weight, despite efforts to maintain a healthy diet and exercise routine. Moving on, some women with PCOS may notice changes in their skin. This could manifest as oily skin or acne due to the hormonal imbalances associated with the condition. All these symptoms might seem unrelated, but they are all pieces of the same puzzle. It's important to remember that not everyone with PCOS will have all these symptoms. Some women might only have a few, and in varying degrees of severity. It's also worth noting that PCOS can be associated with other health complications such as type 2 diabetes and sleep apnea. So, if you're experiencing any of these symptoms, it's crucial to consult with a healthcare provider for a proper diagnosis. These symptoms might seem daunting, but it's important to remember that they can be managed with the right treatment. PCOS is a common condition, and with the right knowledge and resources, it can be navigated successfully. So don't lose heart. We're here to help you understand and manage this journey. But what exactly causes PCOS? We find ourselves asking this question as we delve deeper into understanding polycystic ovary syndrome. Unfortunately, the precise cause remains unknown. However, current research suggests that it's likely due to a combination of factors, with abnormal hormone levels playing a significant role. Let's take a moment to discuss hormones. They're like the body's chemical messengers, with each hormone having a specific task. In the case of PCOS, there's an imbalance in the hormonal orchestra. One of the key players in this imbalance is insulin, a hormone that controls sugar levels in the body. Many women with PCOS are resistant to the action of insulin in their bodies, causing them to produce higher levels of insulin to overcome this resistance. But why does this matter? Well, high insulin levels can lead to an increased production and activity of hormones like testosterone. Now, let's talk about how PCOS can affect pregnancy. Women diagnosed with polycystic ovarian syndrome are at a higher risk for certain complications during pregnancy. One of the major concerns is miscarriage or early loss of pregnancy. Women with PCOS are 3 times more likely to miscarry in the early months of pregnancy compared to women without this condition. Another complication is gestational diabetes, a type of diabetes that only pregnant women get. If not controlled, it can lead to significant problems for both the mother and the fetus. However, it is treatable and typically resolves after the baby is born. Babies born to mothers with gestational diabetes can be larger than average, which may necessitate a C-section delivery. Both the mother and child are also at a higher risk for type 2 diabetes later in life. Then there's preeclampsia, a condition characterized by a sudden increase in blood pressure during pregnancy. If left untreated, it can lead to eclampsia, which can cause organ damage, seizures, and in severe cases, even death. The primary treatment is to deliver the baby, even if it means a preterm delivery. Another potential complication is pregnancy-induced high blood pressure, which can occur in the second half of pregnancy. If not treated, it can lead to preeclampsia and the need for an early delivery. Lastly, women with PCOS are more likely to have a C-section delivery due to the associated pregnancy complications. While a C-section is a common procedure, it does carry risks like any other surgery. In spite of these potential complications, it's important to remember that they can be managed with appropriate medical care. Regular prenatal checkups, a balanced diet, regular exercise, and following your healthcare provider's advice can go a long way in ensuring a healthy pregnancy and delivery. While these complications can be serious, they can be managed with appropriate medical care. So, what can be done to manage PCOS and its impact on pregnancy? Well, there's no one-size-fits-all answer to that question, as the treatment for polycystic ovarian syndrome varies depending on the individual's symptoms and how they are affected by the condition. For some, lifestyle changes such as a balanced diet and regular exercise might be enough to regulate menstrual cycles and reduce the symptoms of PCOS. These changes can also help manage insulin levels, which can be particularly beneficial for those who are overweight or obese. Medication can also play a key role in managing PCOS. Birth control pills, for instance, can help regulate periods and reduce levels of male hormones. Metformin, a medication typically used to treat type 2 diabetes, can also be used to manage insulin levels and regulate menstrual cycles in women with PCOS. In terms of fertility treatments, clomiphene and letrozole are commonly used medications to stimulate ovulation. For women who do not respond to these treatments, gonadotropins and in vitro fertilization might be considered. In cases where PCOS leads to complications during pregnancy, such as gestational diabetes or preeclampsia, additional medical care and monitoring will be necessary. It's crucial to note that every woman's experience with PCOS and pregnancy is unique, and what works for one person might not work for another. Remember, open communication with your healthcare provider is key. They can provide personalized advice and treatment based on your symptoms and overall health. And that brings us to the end of our discussion on PCOS and pregnancy. It's crucial to keep in mind that while PCOS can complicate pregnancy, it doesn't have to define the experience. With the right care and treatment, it's entirely possible to manage the condition and have a healthy pregnancy. Remember, PCOS is a manageable condition, and with the right care and treatment, it doesn't have to define your pregnancy experience. Please like, share, and subscribe to spread the word about PCOS and its impact on pregnancy.